This is Behind the Headlines, with behind-the-scenes analysis on issues affecting Pennsylvanians, sponsored by the Susquehanna Valley Center for Public Policy. Now, here's your host.
From Philadelphia to Erie, from Pittsburgh to Scranton, it's Behind the Headlines. I'm Charlie Greenewalt, the Senior Fellow for the Susquehanna Valley Center for Public Policy, and I'm joined by Maura Donnelly, my co-host. Maura, welcome.
Hello, Charlie.
Why, Donald Trump is taking the nation by storm.
Yes, he is. I love it.
What do you think how do you think he's going to do in Pennsylvania?
Well, I think he's doing really well everywhere because he's resonating in a lot of ways. I'm not sure he'll actually be the candidate, but he's doing good things for getting people interested and excited in politics. So it's a win right now for him.
I guess in expressing the common person's indignation about much of what might be happening at one level of government or another.
He has a way of expressing. That's for sure.
Well, one area of public policy, I don't know that I've heard the Donald talk about this area, is, of course, health care. And we have the best person in Pennsylvania to talk about health care today with us. And of course, that's Andy Carter. Andy is the president and CEO of the Hospital and Healthsystem Association of Pennsylvania. Welcome back to the show, Andy.
Thanks, Charlie, and thanks, Maura.
Nice to see you.
Yeah, it's so nice to have you back, Andy. Of course, we are dealing here in Pennsylvania with the budget impasse on Capitol Hill here in Harrisburg. Lots of people thought that it would last this long and maybe longer. Other people thought that there'd be a compromise by now. This budget impasse is probably affecting hospitals around Pennsylvania, but the common person the average person doesn't know what effect it's having. We're wondering if you could enlighten us and tell us exactly what's happening in our hospitals in regard to what's happening on Capitol Hill.
Well, thank you, Charlie. It is disappointing that this stalemate is continuing, but you're right. We had expected some degree of delay because we have two groups who really have been endorsed by voters to take strong stands. And so we're seeing the impact of the voters' uncertainty about the direction they want government to take. But for those of us in healthcare, it's getting increasingly troublesome to imagine how long this stalemate might go on. Just to give you an example, we are already feeling modest impact from the delay. Normally, by this time of year, roughly $60 million in payments that come to us through special programs we have jointly through the federal and state governments, those payments would have been made by now. And so those are on hold pending this stalemate. And if we don't get this resolved in the next several weeks, another $100 million or so that is supposed to flow to hospitals to provide high-priority health care services also will be delayed. Now, I don't want you to think that hospitals don't have access to funds to bridge this time period. But it gets harder as time goes on, particularly for those of our hospitals that are struggling financially, and at least a quarter of them are running in the red. So for them, incurring borrowing costs, well, that's not a good use of resources to have that turning to banks to borrow money to meet cash flow needs. So we're hoping for as speedy a resolution as we can get.
Well, the bottom line is I think no one, no entity, no organization, no charity should have to go through this right now. I mean, I think that they really need to pass the budget and help everybody out, including hospitals. I mean, it's just a little bit crazy that it's going on this long.
Well, and I understand, and my members understand, I hope the patients that we serve understand that the issues on the table that the administration and the legislature are grappling with are huge. Tax policy, education policy, and the like. But for health care, we are a state poised to be among the best in the world. We have world-class institutions, and they are world-class institutions facing increasing expectations from patients and communities. I mean, every time we turn around, people want to know, what are you doing to update this 40-year-old building? A lot of healthcare facilities were built in the 70s and 80s, and it's time to make sure we're modernizing those facilities. So now's no time to stop and not continue the investment in that innovation that we have to get done as quickly as we can.
Could you tell our viewers what the budget that has been passed by the legislature aims to do that the governor's proposed budget perhaps doesn't do. How do they stack up in terms of the hospitals, the effect on the hospitals of the Commonwealth?
Well, thank you for looking into that issue, because it's really a tale of two cities. The governor's original budget included upwards of $167 million in increased taxes and cuts for hospitals. The legislative budget, on the other hand, actually cuts that tax increase for hospitals in half, eliminates cuts that the governor's budget included for burn centers, maternity units, and our 13 critical access hospitals. Reversed those cuts altogether, cut the tax in half, and produced a plan that invested federal money back into hospitals to allow us to stay on track to our efforts to modernize facilities, our efforts to make sure we install computer systems to serve patients more effectively, our efforts to continue attracting high-quality clinical leaders, physicians, nurse leaders, and the like. So that's two starkly different approaches to healthcare funding. Obviously, we are championing the legislative budget.
I could have guessed that.
Yeah. and it's the right way to go. And when you are committed to trying to rebuild this economy, and you know that the hospital industry alone accounts for upwards of 600,000 jobs and adds $111 billion to the economy every year, both directly and indirectly. If you believe in restoring economic growth, hospitals have to be a partner in that strategy. And I think very clearly the legislature has acknowledged that reality, and their budget reflects it.
Well, this is the time of year when rumors abound. What are you hearing about the process? Are you involved? Are you talking to anybody? Are you at the table at all? What's happening?
Indeed.
Or what are you hearing?
Yeah, imagine an onion. There are many layers of discussions underway at different levels. On the healthcare scene, both sides of this debate are very active, I mean, at least with us. We're pleased that we're in discussions with the administration to try to find ways to help it achieve its objectives, which are honorable and reasonable, to ensure that we have high-quality health care and that taxpayers aren't putting good money after bad in health care. They shouldn't. And the administration believes in establishing incentives to improve the quality of care. We agree with that. So we're in discussions with them about how to put in place a quality improvement strategy that Medicaid supports, so that voters at the end of the day can look at how much money we're spending on health care and say, we're getting value for those dollars. The administration is committed to that. But there are a lot of details to work out. Mm-hmm. The legislature has also been very open to working with us. The budget that they passed reflects intense conversations between us and legislative leadership. And I think at the end, these are all people with goodwill and good intentions. We will get there. And we're doing our part. I mean, hospitals contribute already $150 million to the general fund to help balance the budget. We're prepared in the legislative budget to add another $65 million to our contribution to get to a balanced state budget. So we're doing our part. There's not any more we can do. We've put our best foot forward, and now we just have to hope that they reach agreement as quickly as possible.
I may be wrong about this statement, Andy, but I don't believe that most of our viewers or most members of the general public know that there are taxes on hospitals. What is the tax called? The Hospital Quality Care Assessment. Most hospitals that I know are just struggling to get by and provide the services to the general public that we all need and we've come to expect. Can you talk about
Sure.
this tax a little bit? And how much can we expect hospitals to pay above and beyond what they are already?
Well, it started back in 2010 when we had a tough budget.
It's pretty recent then.
It is relatively recent.
Yeah.
Okay.
And the tax on hospitals is a rare example when people find that a tax creates a win-win for everybody. So this is a good tax. In this tax, we agreed to have ourselves taxed, and that generates a certain amount of revenue that's used for health care. And since it's used for health care spending, it's eligible to draw in federal money of an equal amount. And so we just bring in extra resources, some of which goes to the general fund to help balance the budget, and the majority of which goes to support improved health care payments. The reason that was important to do was that unfortunately Medicaid really doesn't pay the full cost of providing care to Medicaid patients. On average, it's only about 81 cents on the dollar. And this tax helps us do a better job covering the cost. And so that's where everyone wins. The trick is when the Commonwealth tries to take too much away from that pool of funds we create to try to balance the general fund. We just can't stand by and watch too much money flow into the general fund. We owe it to the patients we serve to get as much of those resources into direct patient care as we possibly can. So there's a limit to what we are willing to do to help balance the books. And right now that limit is about $205 million that we're willing to put on the table.
So the governor's tax increase of 18%, I assume they earmarked a huge amount of it or all of that for the general fund? And that's,
as we read the budget, all of it was going to go to the general fund.
That's where the problem is then.
On top of the money we were already contributing
Right.
of $150. So we're approaching $300 million. Now, I know your viewers don't like hearing all these numbers about tens of millions of dollars, but it's order of magnitude, a huge increase in what would go from hospital patient care services into the general fund.
But our viewers would like to know what you just explained, which is that a huge amount of that money goes right back into health care in Pennsylvania, and that what the governor is proposing is that it go to help balance the budget. And they would be very interested to know that.
When you ask Pennsylvanians, whether they're voters or not, what do you want from health care? And they will tell you, A, they want to be treated like a person. B, they want to have good technology and to know that the clinical professionals caring for them are using best practices, that they know what they're doing. And that's what we're committed to doing day in, day out. And I think the investment taxpayers make in that work is not just for people who receive Medicaid benefits, but actually those resources go to build the entire infrastructure that takes care of all three of us and all 12.7 million Pennsylvanians.
Wow.
In the last 30 seconds, Andy, the longer the budget impasse goes on, what happens with our hospitals?
The more financial stress they face as these payments, that a portion of the payments that we count on to deliver care get held up.
Are services going to disappear?
No, we will do everything we can to continue serving patients, but it will create more and more financial stress that impedes our ability over the long term to be the best.
Okay. Well, we want to thank you for giving us an update and being with Mara and me today. Really appreciate it. Look forward to your next appearance and hear what's going on in the world of our Pennsylvania hospitals. We'll be back with the second segment of Behind the Headlines right after this. Stay tuned.
Behind the Headlines is brought to you as a public service by the Hospital and Healthsystem Association of Pennsylvania, helping hospitals provide healing, health, and hope to communities across the state. And by the Pennsylvania Business Council, envisioning a commonwealth in which residents enjoy a very high quality of life in sustainable communities. The council works aggressively to define key long-term policy strategies and solutions to make the commonwealth more competitive, creating and sustaining a better Pennsylvania. Additional underwriting provided by the Worrell Corporation Foundation, based in Carlisle, Pennsylvania, by the Edward H. and Jeannie Arnold Foundation, and by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business. Behind the Headlines is also supported as a public service by Daily Express, transporting construction, farm, and industrial equipment throughout the United States, and by Blackford Ventures, LLC, a private equity firm seeking to make significant investments in real estate, proven business enterprises, and their leaders. Find out more at www.blackfordventures.com. And by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Visit pahighwayinfo.org.
Hi, welcome back to the second segment of Behind the Headlines. In this segment, Mara and I are happy to welcome to the set Ken Mash, the president of APSCUF. Ken, welcome back. You, of course, are president of the faculty union that represents the 14 state universities here in Pennsylvania, the state system. You find that we still don't have a budget on Capitol Hill here in Harrisburg. How has that affected your organization?
Well, first, thank you, Charlie. I appreciate it more. It's great to see you again.
Great to see you too.
Well, you know, at this point, it has not yet had a real impact. The system itself estimates that it won't be until late October, November, that they start to feel the pressure. Our students are starting to feel some of the pressure because student loans are hung up with it. So, you know, for us, it's a situation where we're entering in and we're not happy that there's a hang up here, but we're also rooting very heavily for increased funding. So we're in a good position right now. The governor proposed that there be a $45 million increase for next year, and then a $45 million increase the following year. That was to make up the $90 million that was cut from the state system in 2011. We're fortunate because the Republicans, too, have proposed an increase. They've proposed an increase of 3%. The governor's proposal is for 11%. But, you know, our indications from the legislature is that they really do understand that our universities are under a lot of pressure, that they're not capable of doing the things that they had done in the past. We are now at a funding level that, the same funding level that we were at 18 years ago. And so we're trying to do the same things with really 20% cut in the budget. We had our students, there was a 3.5% tuition increase, across the board increase for them, and for their fees too. You know, that makes up some of the gap, but we're doing it on the backs of our students. We're doing it on the backs of their families as well. And student debt, according to the Keystone Research Center, students are now graduating from like $30,000 in debt. And, you know, that's not just harmful to those students who, you know, are going to be feeling that for the rest of their lives, really. It's also harmful for our economy because that's money that's going back into paying off this debt instead of them being active consumers, buying houses, buying cars and things like that. Instead, that money's going back to pay debt.
Well, we're about almost 60 days around that into this budget impasse. So it's gone on for quite a while now. Let's assume it gets to be the end of October and we still have nothing has happened. When you say we're going to start to feel it, what does that mean? How are you going to start to feel it?
Well, the universities, I mean, and you know, they're able to operate because they do get tuition money. So that tuition money, they're able to run off of that tuition money, and they also have some reserves at most of the universities, and they can run off of those. But you know, for some universities, it's very tight, and that tuition money is going to run out. And what we mean is, you know, you're not going to have money to make payroll. You're not going to have money to heat the building. It's going to be
that severe.
It can get that severe for the universities, just like it might get severe for our public schools. As we move along, they're going to run out of money eventually too, and every agency will run out of money. And you know, that's what we're facing overall. You know, we're kind of in this period where there's pain being felt right now, but it's by really social service functions of the government, and that's a small but important percentage of it. But really, overall, the average citizen's not really feeling the pain of that. But that pain will come. People will feel it in the weeks ahead.
Well, Ken, you talked about this budget impasse on Capitol Hill here in Harrisburg, holding up student loans. So do those students have to sit out the semester until the budget is approved? What happens to those individuals whose loans are hung up?
Well, the universities are working with them. You know, they're anticipating the money. So they could operate with this anticipation that they are, in fact, going to get the money eventually. So they're able to move along, but again, it's held up in that how long can we go on doing that? So that cuts back on the amount of money that the universities can operate with. So the FIA, right, if they're not getting their funds and they're not distributing it to the students, ultimately the universities don't have money.
Well, don't they use some of that student loan money for books and things, so that might some out-of-pocket expenses, they might be feeling a pinch there.
Yeah, absolutely. Yeah. So, you know, they are going to feel that end of it a little bit.
But not the tuition end of it.
Right, but not the tuition end of it. And I think even there, though, I think some of the universities are trying to work with the students to figure out how can you get your books and,
Right.
and work it out so that percentage of it you're still going to get.
Good.
But still, again, with the anticipation that they're going to get the money back.
Well, here we are at the beginning of a new academic year, and we find across the country higher education is experiencing some enrollment pressures. What are the enrollment trends in the state system of higher education, and what are the reasons for those trends, and what is your organization, how's it responding to those trends, Ken?
Right. Well, first of all, this is the start of the semester, and it's a great time for all of us. So, for my faculty and everything, and Charlie, you're a faculty member, it really is a great time because you have that
Everybody's
feeling.
all pumped up.
Everybody's
Yeah.
pumped up. You've got that feeling of, the student ambition, your ambition. Renewal, right. It's a great thing being in academia. It's a wonderful job. And you really can feel that from the students. And I know everybody I speak to is really excited about that. The enrollment, there are enrollment pressures. It's different depending on which part of the country that you are in. And it's different for us depending on where our universities are as well. Mm-hmm. So for us, enrollment is down really just a very small percentage from last year. And it's really in a couple of the universities mostly where we're feeling that pressure. Otherwise, it's been fairly steady, and 3 of our universities actually have increased enrollment this year. So I think we're holding steady now. What are the reasons for that? Well, largely it's a matter of demographics. So when you have less students graduating high school, you have less going to college in the end. And so when we track the demographic data, they thought it was going to be horrible. They've actually readjusted the numbers, so it's not going to be as dramatic as it once was. It's the same thing when you start talking about teachers, right, and the demand for teachers. We were in a period of time when they were saying, well, there's not jobs for teachers in Pennsylvania. Around the country now, what we're seeing is actually a teacher shortage. Because what happens is, the students can read the market. Yeah. They won't go into teacher education. They direct themselves elsewhere, but then suddenly there's an increase, and then all of a sudden teachers are needed all over the place. We're not yet feeling that in Pennsylvania, but the projection is that we will. So, there's going to be jobs for teachers, and eventually, too, the enrollments at our universities we're expecting will go up, but not dramatically go up. But, we are going to remain fairly steady, and hopefully there'll be a slight increase at least.
I would recommend to anybody to become a teacher. All of my friends that are teachers are now retired.
Really?
And it's just, it's amazing. They've had wonderful careers, and they really have done really well and loved it.
We won't talk about this
really
being a function of your age.
It is a function of my age.
Of our age.
Of our age, yeah. But that's the point. I'm nowhere near retirement.
But I think it also speaks to the role of being a teacher, being an educator overall, and that I don't think people fully appreciate the intensity of what that means to do. Right. So you have a career, and you might retire a little bit earlier, but there's a lot of pressure over that period of time. Going in and putting in that effort and giving to the kids, which we all love to do.
I think they did amazingly well as teachers. It's great career. So we'll encourage any Pennsylvania student.
Well, in this new academic year, Ken, what are the main objectives for APSCUF in this upcoming university year?
Well, I'm sorry, but you were talking about the budget, and obviously the budget is for us extremely important. We've lived through now, 5, 6, even going back, not just the previous administration, but the administration before that, in sort of this attitude of do more with less, do more with less, do more with less. And eventually you get to that point where you're doing just less with less. And we're not, I think it holds back not just our students, but it holds back the Commonwealth too. Universities need to be places where ambition is important, looking at the future is important, talking about ways that you can serve and do more is important for the Commonwealth. But our universities have been in this position of retract. How do we do more with less? And after a while, even that starts to eat away at innovation. It starts to eat away at ambition. And we need to start to return to a place where we're not talking about, how do we do this without hurting quality? How do we cut back more without hurting quality? And just focus on quality. Just focus on being innovative. Start looking at what are the needs for the future and technology. Are we really servicing our students well by providing them a broad liberal arts education? That's what we need to start focusing on, but we're not going to be able to do that if we're constantly in the cycle of cut back, cut back, cut back. So, we're really hoping and we're really working to try and get that message out to all of the legislators out there. The governor seems to get that pretty clearly, that we need to, in order to be able to help the Commonwealth, we need to be able to have the funds to do well. And on top of that, we've been raising tuition. Fortunately, at our universities, we do care about cost, and we've kept our tuition fairly low still. It's about $7,000 a year, which is pretty pricey, but nevertheless is pretty low cost compared to other universities. But nevertheless, every time you raise tuition, you're closing out some people. You are making it less affordable. And when you look at tuition and you look at the fees and housing costs and the rest, it just gets more and more expensive. So we're about opportunity and trying to get as many of our students on board too.
Okay, well, Ken, we want to thank you for coming and sharing your time with us today, and we wish you a good new year. It is interesting, I just saw over the weekend a new study that said of all the excellent jobs that are coming available in the last year, 97% of them went to individuals with college diplomas. So that's another, I guess, argument.
Encouraging.
That's a great point.
That can be used on Capitol Hill. But Maura and I want to thank you so much for being with us, and we hope that you'll be with us again next week when you dial in for another edition of Behind the Headlines. We'll see you then.